I am Dr. Sudeep Gupta. I'm a medical oncologist at Tata Memorial Center and also the director of this institution for the past a little over 1 year. And prior to that, I was the director of the Advanced Center for Treatment Research and Education in Cancer. Coming to your question about the importance of hygiene in the recovery of children who suffer from cancer, if I was to give you a short answer, it is vital and it is extremely important. If I have to give you a longer answer, then the treatment of children with cancer is relatively intensive. It involves surgery and prolonged courses of chemotherapy in many instances. And we know that chemotherapy has a propensity to lower the immunity and predispose children as well as adults to all kinds of infection. So therefore, it is extremely important for there to be no breaks in treatment, and for that to happen, we need hygienic environment, clean clothes, clean surroundings, and hygienic food. And I'm very happy that St. Jude's provides all of these and more in its ambience and in its locations. Children who have cancer are a unique group. And I say this because, unlike adults, the cure rates for children with cancer is very high, more than 75 to 80%. At Tata Memorial Center, we see a large number of patients get referred to us from all over the country, and in some instances, even from outside the country. And all of those patients actually require prolonged treatments, and many of them belong to the underprivileged sections of the society. So one of the most important needs of these patients and their families when they come to a city like Mumbai is long-term accommodation. And I think if I was to point out one thing that St. Jude's has done for these children, patients with cancer, it is to provide them high quality accommodation for the duration of their treatment. Therefore, our partnership has been very important, it has been fruitful, and I hope that it will continue in the years to come. We and Tata Memorial Center is a large volume center for pediatric patients. We register close to about 3,000 new cancer patients, children cancer patients every year. And therefore, I think it has been very, very important and very productive in terms of reducing the defaults on treatment. More than 12 years ago, we had more than 25% of these pediatric cancer patients who did not complete their treatment. Now that percentage has fallen to less than 1 or 2%. And I think apart from other things that have led to this very important outcome is the fact that they get good quality accommodation while they are being treated at our hospital. Tata Memorial Center is now an institution that is located in 7 states of India, including in Maharashtra, Punjab, Uttar Pradesh, Bihar, Assam, Andhra Pradesh, and now soon in Odisha. All of these centers have either already become important centers for treatment of pediatric cancer patients or are likely to become important centers in the years to come. Our partnership with St. Jude's in Mumbai, in Parel, led us to believe that it will be a very, very important accompaniment to the medical treatment to have safe accommodation. In Kharghar in Actrek, we are building the largest pediatric cancer hospital, at least in India. It has more than about 350 beds where children will be treated. And so I think to have a St. Jude's center within the Actrek campus in Kharghar was a natural corollary of having such a large hospital for pediatric cancer patients. And it will be a unique demonstration of the fact that children will get referred from all over India. They will not only get the medical treatment, but they will also have accommodation to stay sometimes for many, many months or even more than that. Going forward, we intend to consolidate most or all of our pediatric cancer services at ACTREC in Kharghar, at least the majority of those services. So I think it will be like a one-stop shop for pediatric cancer patients, both for their treatment and for their living facilities along with their parents. I think the other thing that is extremely important for these children cancer patients is for their other social needs, such as education, uh, play, entertainment, and overall development while they're undergoing their treatment to not suffer during that process. In Kharghar, in ACTREC, we will have the ecosystem. We already have the ecosystem, and we will make it even better to be able to care for these children cancer patients in a comprehensive manner, not only looking at their medical needs but also social needs.